Welcome to Dynamic Medicos. In this video, I am going to talk about umbilical hernia. So, let's first start with the definition. Before it, if you are not subscribed to my channel, then please do subscribe and hit on the bell icon to get notified for the further videos. Now let's see what is umbilical hernia. The umbilical defect is present at the birth but closes at the stump of the umbilical cord heals, and usually within a week of birth. This process may be delayed, leading to a development of an herniation in the neonatal period. The umbilical ring may also stretch open in the adulthood. So there are three types of umbilical hernia. First is in the newborn, second in the infants and the children, and third one is in the adults. Now let's first see the umbilical hernia in the children and the infants. It occurs up to 10% of infants, higher incident in the premature babies. Hernia appears within a few weeks of the birth and it's symptomless, and it increases in the size on the crying and assumes a classical conical shape incidence. Now let's see the treatment part. First, conservative treatment is indicated under the age of 2 years when the hernia is symptomless and the parental reassurance is all that is necessary. 95% will resolve spontaneously. If the hernia persists beyond the age of 2 years, it is unlikely to resolve and surgical repair is indicated. Next is surgery. In the surgery, small curved incision is made immediately below the umbilicus. Neck of the sac is defined open and any content are returned to the peritoneal cavity. Then sac is closed and the now let's see in the adults the hernia does not protrude through the umbilical. It is a protrusion through the linea alba just above the umbilicus or occasionally below the umbilicus. That is why it is called as para-umbilical. The content of the hernia are usually greater omentum, often accompanied by a small intestine, by a portion of an transverse colon. In the majority of the case, the sac becomes loculated due to the adherence of the omentum to its fundus. That is why the para-umbilical is reduced. Now let's see what are the clinical features. Women are by far a major victims and are affected 5 times more frequently than men. Obese patients are mainly involved and they are usually above the 40 years of age. Obesity, flabbiness of the abdominal muscles, repeated pregnancies are the predisposing factors. Some sort of discomfort or a pain is often complained or when the hernia is quite small. Transient attacks of intestinal colic may be present as may be a subacute intestinal obstruction. On examination, the position, the main bulge of the hernia is mostly just above the umbilicus through linea alba or occasionally below the umbilicus through the midline. Consistency, the lump is firm as contains mostly omentum, or percussion is dull if it contains a small bowel. It may be resonant when the contents are not adherent, this hernia becomes reducible and exponential cough impulse becomes also evident. But unfortunately, in many herniae, the contents are adherent, so the hernia become irreducible and pulse on coughing is absent. Thanks for watching the video. Please do like, share and comment on my video and subscribe to my channel Dynamic Medicos.